The 4 objectives in the Rotary program include empowering community health, building capacities of the health facilities, supporting health in schools, economic empowerment for 800 households. Community health strategy is bringing health care services down to the household level. Community health strategy was launched in the year 2006 by the Kenyan government. This was because there was wanting indicators. The wanting indicators were like immunization, delivery, skill delivery, and even nutrition services in children among under 5. These were wanting, and it was important for the government to come up with a strategy which will address these issues. All stakeholders have to come together to support community health strategy. For effective community health strategy, the CHVs need to be trained, need to be mentored, and support supervision. So the government alone is not able to implement it alone. That is why it is necessary for all stakeholders to come up together so that it is implemented accordingly. So Rotary was important as a partner to bridge the gap what the government is not able to do.
It's a bottom-up structure whereby the community people speaks out their problems, they sit down and sees way forward how they can solve the problem which is affecting them.
A community health worker is a person selected in a chief's baraza. The community are told about the criteria. The criteria include popularity, literacy, and they are volunteers.
THC, we mobilize the community members during dialogue days, which takes place every month. And also during action days, also takes place every month.
My role as a community health volunteer is to link the community to the facility and do referrals as well. The Rotary has fulfilled our roles as a community volunteer by giving us mentorships, monthly mentorships. The ways I do reduce the incidence of malaria in the community is by telling people to use treated bed nets. And secondly, we do test malaria by using rapid diagnostic test, which is in short we call RDT, by testing malaria from the finger. Whereby if that cassette 2 lines appear, that is malaria positive. When it is 1 line, that is malaria negative.
In my role as a community health volunteer, I have many roles. One of them is to do referrals. I also do household visitations. I make follow-ups on the referrals I do. I also do defaulter tracing in ARVs and TBs, and also for children under 5, who are under 5 years, who have not completed their immunization.
We have indicators we have been wanting. This is child and maternal health indicators. HIV prevalence is also high. So what has been improved that the community volunteers have been referring clients for immunization and even defaulters in TB and HIV. We have seen an improvement in the link facilities Masala and Papkodero because of the efforts which have been made directly by the community health volunteers. The Rotary did renovate Masala and Papkodero and also equip them so that when the clients go there, they get quality service. These ones have greatly improved the quality of services, and this is a great motivation to the community health volunteers as well.
Say, if Rotary would not have done something about this institution, we would not be where we are. I would first of all start by even the fencing itself. Initially, the fence that we have here was not there. It was you could pass through any other route, and now they did the fencing. They brought tanks. We have got around 7 tanks. We also have got a solar system that they also installed, and is very, very effective. You remember we have got immunization activities here, and that one means we have got the vaccines, which needs a cold chain around the clock. And without steady power supply, then it means we would not be giving some of the potent vaccines.
As a facility, I can say that Some of the apparatus that we are using here, i.e. the microscope, and even the renovation of this laboratory, was funded through the Rotary.
With regards to school, the biggest change I've noticed is a shift in sanitation and hygiene practices among the school-going children.
The term WASH stands for water, sanitation and hygiene. And because of this WASH, I can now maintain my personal hygiene, e.g. by use of sanitary towels, cutting my nails short, combing my hair.
The health of most children has improved in that nowadays they are healthier and they attend school because the programs that are organized by Rotary has made them to make practices or to adapt practices that make them healthier in school.
Can somebody name another part in the female reproductive part?
Before sanitary towels, I could have been absent in school for more than 3 days. Because I lacked sanitary towel, I could not come to school.
The sanitary towels have made the girls to perform well in school. They are happy, they are healthy, and they can move freely.
It has changed my life because I'm in school throughout and I've improved my performance. And girls in our school are now coming to school every day.
I'm proud because in the past, cholera used to be in my sub-location, and that cholera is no longer there. People have managed to put up latrines and have practicing health hygiene.
What makes Rotary project unique is that it integrates economic empowerment into health.
Tangu nianze kujuana na watu wa Rotary, walikuwa kunipea vitu vingine like mbuzi, kuku, na hizo mfugo niko nazo zinanisaidia.
Ago erokamano ni Rotary kuom purona. Ne gisemiya kodhi, ageno ni abiro yudo cham maber kendo apidho go nyithindo.
The Rotary has trained the CHCs. They know their roles. They have given us bicycles, so transport is not a problem. And they have also given us incentives and rewards.
So even the government policy of accessibility, retention, transition and completion has been achieved through the partnership of Rotary International. And I will urge them to continue organizing programs which will help the students here.
Thank you for Rotary support, for providing me with sanitary towels, keeping me clean, and I'm now happy.
Thank you, Rotary, for the project that you have brought, and now I'm free girl.